You know, measles no longer a thing of the past. There is a major measles outbreak in South Carolina right now with cases skyrocketing in the last week. We pulled up this map for you here. This is from the CDC. It shows 145 confirmed cases in South Carolina and one in Georgia. You see clearly South Carolina bolded dark blue there. They have the worst of it right now by far. And by the way, this data, a week old. So once it gets updated tomorrow, expect even higher numbers. Joining us now to walk through what we should know and what all families out there watching should know is Dr. Andi Shane from Emory University and Children's Healthcare of Atlanta. Dr. Shane, thank you so much for your time on an important topic. You know, a lot of parents hear measles and they think that's no longer a threat. How concerned should parents be right now?
So thank you, Dan. Right now, we are very concerned about measles, especially with this recent new case in Georgia. Measles is a very highly infectious virus, probably one of the most infectious viruses that we know. It spreads by the airborne route. And not only does it cause an immediate acute illness of fever, cough, runny eyes, runny nose, and a really miserable feeling person, but it also can result in pneumonia, hospitalization, dehydration, and also there are rare but long-term effects from having a measles infection.
So even with just this one case in Georgia, you are concerned about the spread because it's airborne. I mean, can you just walk us through how quickly the measles can spread in an everyday setting like a school, for example?
So, yes, it can spread very quickly, and we unfortunately have evidence from South Carolina to see that. But basically, the measles virus is very infectious. In a room of 10 people, 8 who are unvaccinated would be infected, and so that's about an 80% rate of infection, and so we are really concerned. The other challenge also is that some people can spread the virus before they actually have symptoms, and so they may be exposed but not having symptoms, and so they would be out in the public and potentially able to infect other people.
So how preventable is this? Let's talk about the vaccine and what you want parents out there to know about the efficacy.
So the MMR vaccine, which is the vaccine that contains measles, is a very safe and very effective vaccine. We've got decades of experience with its use, and it's very effective in preventing measles infection. One dose prevents about 93% of people, and the second dose prevents about 97% of people. And so really what we need everybody to do is to make sure that they're up to date on their measles vaccine. That way they will be protected, and we will stop the spread of measles.
Aside from this being able to just spread so quickly and easily, what else worries you about a child contracting measles? Are there any long-term implications at play here?
Yes, so unfortunately, many children who get measles become dehydrated and have to be hospitalized to get hydration. Some may develop pneumonia. And then also what we do know is that after a measles infection, your immune system does not work as well for weeks to months after you have the infection. And so that is also a challenge. You may be more susceptible to other infections after recovering from a measles infection. And then finally, there's a rare but fatal complication of an acute measles infection that may occur 7 to 10 years after the initial infection. So we worry about those long-term complications as well.
I got to ask you on a personal note, when you were in school studying infectious diseases, did you ever think you'd be living through a pandemic, much less a few years later, the reemergence of the measles?
I never imagined that, and I really wish that this wasn't happening. But we do have the power to stop the spread of measles, and that is by being vaccinated. And I would really encourage every parent to make sure that they themselves are up to date and also that their children are up to date.
Dr. Shane, thank you. I think one more question I want to ask, because this is going to be something to watch. You know, Canada lost its measles elimination status after nearly 3 decades. Are you concerned that this latest outbreak could mean the U.S. losing its measles elimination status that we've had for so long?
I am very concerned, Dan, and I think we are very, very close, unfortunately, both with the outbreak in South Carolina and now a new outbreak in Washington State. I see that there will be many more outbreaks as people travel and, unfortunately, as this virus spreads. So once again, we have the power to stop the spread.
Dr. Andi Shane from Emory University and Children's Healthcare of Atlanta, thank you for what you do for children in our area, and thank you for your time this morning.
Thank you. My pleasure.